Okay, so let's get started. So, like Christine said, my name is Jessica. I work for a company called Gray House Publishing. Gray House is a reference publisher. So we produce books and online databases for the library market. So what my job is to provide library patrons with information on a number of different topics. And the database that we'll be talking about today is produced in conjunction with Weiss Ratings. And they provide a Medigap pricing tool and insurance ratings that are independent, unbiased, and accurate. Now, because I work for a publisher, I'm not here to sell you insurance. We don't work with any particular insurance company. We provide unbiased and accurate ratings of those insurance companies. So you can rest assured that the information that you are going to get here today is completely unbiased, and we're here to just provide you with information. And this discussion is designed to help you navigate through the Medicare maze. Our primary goal is to tell you about the choices you have available to you and help you save as much money as possible. At the end of this talk, you'll be able to download your own customized Medigap report that can help you find and select the best Medicare supplement insurance policy for you with the strongest companies for the least amount of money. And you can do it for free with your library card because Des Plaines Public Library subscribes to this tool, and you have access to this information just by logging in to their website and connecting to the Weiss Ratings database. So here's what we'll cover today: the major expenses that Medicare doesn't cover, when is open enrollment and what does that mean, why Medigap can be better than Medicare Advantage, and how to get lower premiums and save hundreds, even thousands of dollars. So you might ask yourself, well, when can I join Medicare? And you can join initially in the 7 months surrounding your 65th birthday. So the 3 months before you turn 65, the month of your 65th birthday, and 3 months after. If you don't join Medicare during that time, there's an open enrollment period each year, October 15th to December 7th. Now, if you're still working when you turn 65 and you're covered by your employer's insurance, you can still sign up for Medicare, and that will supplement your employer coverage. Most people will sign up for Medicare Part A, even though they have employer coverage when they turn 65 if they're still working. Now, if you currently have a Medicare supplement insurance plan, you can actually make changes to either your plan or your insurer every year during that same open enrollment plan. So that is October 15th to December 7th. And if you do make a change, your coverage will start January 1st. So let's take a closer look at Medicare coverage. Now that's divided into 4 parts. So there's Medicare Part A, that's your hospital insurance. Medicare Part B, that's your medical insurance. Medicare Part C is Medicare Advantage. And Medicare Part D is prescription drug coverage. So Medicare Part A, that covers your hospital-related services and emergency care, like inpatient hospitalization, home health services, skilled nursing services, and hospice. Now, Medicare Part A does not cover all of your hospital costs, and it does not cover long-term care. Medicare Part B, that covers your regular medical care and helps with outpatient services, like doctor office visits, laboratory services, ambulance, and diagnostic services. So if you have Medicare Part A and Medicare Part B, you might think you're totally covered. But Medicare does not cover all of the costs associated with hospital and medical insurance, and it does not cover prescription drug coverage. These are some examples of what your out-of-pocket costs will be if you have Medicare Part A and Part B. So if you have a hospital stay, your deductible will be 1484 or up to 1484, depending on the length of your stay. You have a Part B annual deductible of $203. You'll pay generally 20% out of pocket for most outpatient services and medical supplies. And there's a monthly Part B premium of $148.50 depending on your income. These are some examples of what you'd pay out of pocket with just Medicare alone. And there are other hidden costs like prescription drugs, vision, emergency care abroad, dental, and hearing aids. None of these things are covered by original Medicare. So when Medicare was established in 1965, it was never meant to cover all of the medical care for your senior years. It was intended to cover only the most basic of needs. And you have choices in regards to your health care. You can stick with Medicare Part A and Part B, or you can purchase additional coverage. And you can make this decision based on your unique healthcare needs. And you have two choices to fill the gap. Those are Medicare Advantage or Medicare Part C and Medicare Supplemental Insurance, also known as Medigap. Now, Medicare Advantage or Part C, that's coverage provided by private insurance, and it's limited to a defined network of doctors and providers. It combines Part A, your hospital insurance, Part B, your medical care, and oftentimes includes Part D, your prescription drugs. Now, Medicare Supplement Insurance, or Medigap, that covers deductibles, copayments, and coinsurance. And it's designed to fill in the gaps that Medicare Part A and Part B doesn't cover. So let's look at them side by side. So on the left-hand side, we have Medigap, which is original Medicare, and Medicare Supplement. Now, those plans, they do have higher premiums, but they don't have copays. You have the freedom to choose your doctor. Now, that means that any doctor who accepts Medicare will also accept Medicare supplement insurance. No referrals are necessary, but some routine services are not covered, like vision and hearing. But you're covered anywhere in the United States, and 6 plans offer coverage abroad. Now, Medicare Advantage plans, they generally have lower premiums, but they do have copays. You may be restricted to a network, and you might need referrals for specialists. But some Medicare Advantage plans include extra benefits like vision, hearing, or fitness. But you're limited to emergency services only if you're outside of your service area. So that brings us to secret number 1, and that is that Medigap plans offer identical coverage. Right now, there are 10 Medigap plans, each known by a letter A through N, and 2 plans, F and G, each have an additional high deductible option. For every lettered plan, every insurer that offers that plan provides the same exact benefits. The plans are regulated by the government, so the coverage within each lettered plan is the same, regardless of which insurer you choose. So that means that all Plan A's have exactly the same coverage. All Plan B's are the same, all Plan F's are the same, all Plan G's are the same. And that means that you can pick the plan that has the coverage you want. You can compare one insurer to another, and you can pick the plan that has the best rate. So you might ask yourself, well, which plan is right for me if there's, plan A through plan N? And there are some questions that you can ask yourself to help you make that decision. The first is, what is your income? Now, using the customized Medigap report that you'll be able to download from the Des Plaines Public Library website, you can shop for a Medigap plan that has the most benefits that will fit within your budget. The next question is, do you think you will want or need nursing care? Now, this is a hard decision, of course, because you're looking into the future and no one has a crystal ball, but you can look at your family's medical history. So if your parents or grandparents needed nursing care, you may also need similar care in the future. And the next question is, do you travel a lot overseas? Now, mind you, we're in the middle of a global pandemic right now, so I don't think that most people are doing a heck of a lot of traveling. However, if you do plan on traveling overseas, there are a number of plans that offer coverage abroad. Those are plans C through G, M, and N. Now, when you're deciding between Medigap plans, you can choose to pay a higher premium for more comprehensive coverage or pay less for your premium and potentially more out of pocket. So let's look at plans A through N. Now, this chart is a summary of what each of the plans cover. And each of these checkoff boxes is a benefit that the Medigap plan covers. So you can see from these checkoff boxes that Plan A has the least amount of coverage. It's the most basic plan. And that covers your Medicare Part A coinsurance, your Medicare Part B coinsurance or copayment, your first 3 pints of blood, and Part A hospice care coinsurance or copayment. And you can see that Plan B, that adds your Medicare Part A deductible. That's that $1,400 deductible for a hospital stay. Plan C adds skilled nursing facility coinsurance. And if we look at a little further along, plans F and plans G, these are the most comprehensive plans because they have the most checkoff boxes. So plan F covers everything. Plan G covers almost everything. The only difference is this Medicare Part B deductible. Now in plan G, you pay that $203 out of pocket. And in plan F, your insurance company pays it for you. And they charge you a premium to do that. So let's look at some prices of what these individual plans cost. So I downloaded a report this morning for a 65-year-old female in Des Plaines, and I included here the least expensive plan for each of, or the least expensive insurer for each of these plans. So a 65-year-old female would pay $900 a year for Plan A. If we bounce over to Plan G, you'll see that this same person could pay $1,175 for their Plan G insurance and have, a lot more coverage like skilled nursing facility coinsurance, that Medicare Part A deductible, and Medicare Part B excess for $275 more per year. So what this Medigap supplement insurance tool is designed to do is to allow you to compare all of the plans side by side and then find out what they cost so that you can make a decision on, how to get the most comprehensive benefits for your budget. And that brings us to secret number 2, that Medigap plans are standard, but the rates are not. Insurance premiums can vary by thousands of dollars a year for the exact same coverage. Now, let's say that again. The Medigap plans and their benefits are standard, and that's regulated by the government. What is not regulated is what the insurance company can charge you for that plan. Even though the benefits are the same, they have vastly different prices for the same exact benefits. So it really does pay to shop around, and we make it easy to do that. So here's an example. For a 65-year-old woman living in Des Plaines, if she's interested in Plan G, the highest premium I saw was $4,433 per year, compared to $1,175 per year. Now, these are 2 different insurance companies offering the same exact Plan G, and one just costs a whole heck of a lot more. $3,200 more per year, and that's a savings of over $32,000 over 10 years just by switching your insurance company. Here's another example. A 68-year-old male, if he's interested in Plan A, the highest premium I saw was $4,785 per year, Compare that to 1116 per year. Now, both of these Plan A's are the same. It's not like one is a Cadillac and one is a hatchback. They are exactly the same benefits. One of them just costs more, $3,600 more per year. And this person could save $36,000 over 10 years just by switching their insurer. Now, a couple, if they're both interested in Plan G, the highest premium for two people I saw was $9,429 compared to $2,500 per year. And that's a savings of almost $7,000 per year just by switching your insurance company. And that's a savings of nearly $70,000 over 10 years. So like I said, it really does pay to shop around. And what our tool does, available through the Des Plaines Public Library, is to help you do exactly that. Find every single insurance company that offers coverage in your area and what they charge so that you can make sure that you're getting a good deal. The next question you might ask yourself is, how safe is your insurer? Now, Weiss Ratings rates the financial strength of the entire insurance industry. So we collect their financial data and run it through our models, and then we project their financial strength looking forward. So what we're trying to answer is, how can that insurance company survive a moderate recession or a severe recession? To answer the question, are they going to be there for me in 10, 15, 20 years? So we look at their financials to determine a financial strength rating. And we use a pretty standard report card style grading mechanism. A is excellent, B is good, C is average or fair, D is weak, and E is very weak. Now, we can be like a little bit of a mean teacher where it takes a lot for a company to get an A or an excellent rating from us because our ratings tend to be quite conservative. So that brings us to secret number 3, that safer insurers are not necessarily the most expensive. Higher premiums don't mean that you're getting coverage from a stronger, more financially stable insurance provider. And secret number 4 is that you can make the choice. You can get more coverage for less, reduce your premium, and balance the financial safety of your insurer with your choice of plan. So let's go over those 4 secrets again. That Medigap plans offer identical coverage. Medigap plans are standard, but the rates are not. Safer insurers are not necessarily more expensive, and you can make the choice. Now, you'll be able to, once this meeting is over, go ahead and download your own Medigap report from Weiss Financial Ratings. And our goal is to help you make the right choice for you in your specific situation so that you can pick the right coverage and you can pick the lowest rate. You can save valuable time and money, and you can pick the best and most affordable plan from all available providers customized just for you. And you can get it for free with your library card because Des Plaines Public Library subscribes to this helpful tool. Now, there are some questions that we should tackle before we move forward. There were some changes last year about which plans are available to specific people. So if you were eligible for Medicare after January 1st, 2020, Plan C, Plan F, and high deductible Plan F will not be available to you. If you were eligible for Medicare before January 1st, 2020, you can continue to enroll in Plan C, Plan F, and high deductible Plan F. But if you were eligible after 2020, you can consider Plan D instead of Plan C, or Plan G instead of Plan F. And the only difference between those two options is that $203 Part B deductible. So like I said before, with Plan F, the insurance company pays that $203 deductible for you. And with Plan G, you pay that $203 out of pocket. But other than that, the plans are exactly the same. So if you still wanted to get that most comprehensive coverage level, eligible, you can continue to enroll in Plan G and still get that. But keep in mind, because Plan F, which was the most popular plan, because that plan will not be accepting new people enrolled into Plan F as they turn 65, because it's not available to them anymore. That means that the average age of people who have Plan F will increase, because they're not onboarding new people who are just turning 65. And that will generally mean that Plan F will get more expensive as time goes by. So, if you do have Plan F now, I would just make sure that you price out Plan G as an alternative and know that, the only difference between those two plans is that Part B deductible or $203 per year that you pay out of pocket. Now, this solution offered by Weiss Ratings and its customized Medigap report is to help you find and select the best Medigap policy for you with the strongest companies for the least amount of money. But naturally, every person's situation is unique. So if you have more questions, we urge you to talk to your doctor about your future healthcare needs and make sure that the plan that you're selecting will give you the coverage you need. You can also talk to your insurance company that you've selected to make sure your specific questions are answered. And you can also talk to a SHIP counselor. And SHIP stands for State Health Insurance Assistance Programs, to get personalized one-on-one Medicare counseling over the phone or in person to help you further. You can locate a SHIP counselor in your area by visiting this website, which is www.shiptacenter.org, and click on Find Local Medicare Help. And they're super helpful. They will have a chat with you and really talk about, what's best for you. So I definitely urge you to make an appointment with a SHIP counselor if you have questions. You can actually download the Medigap report from the Weiss Financial Ratings website prior to that meeting, so that once you decide which plan is right for you, you'll have all of the pricing available to you right there. Okay, so here's how you can get your own Medigap report. If you visit the Des Plaines Public Library website, you're going to click on the Resources button up at the top and then select Business and Investing. You'll scroll down and click on Weiss Financial Rating Series. Now you'll enter your library card if you're connecting from home. Now, once you're on our site, you'll click on the Medigap tab, which is in the gray bar on the right-hand side, enter your information, and then download your report. So let's do one together. Okay, I'm going to go ahead and share. Dun, 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 dun. Okay, so let's start with the Des Plaines Public Library website. Okie dokie. So I'm going to click on the Resources tab and then, go to Business and Investing. And then if you scroll down, we're always at the bottom of the page because we start with W, and here we are with Weiss Financial Ratings. Now, if you want to watch a tutorial, you can welcome to click on this link here, but let's go ahead and get into the site. So if you are connecting from home, enter your library card information here, and this is where you will go. So what I want to do is click on the Medigap tool, which is right here in the upper right-hand corner. And then that brings us to a couple of questions that you'll need to answer to customize the report just for you. Now, like I said in the beginning of this presentation, I work for a reference publisher. So we're not here to sell you insurance. So you're never going to hear from us if you fill out your information here. It's completely, we don't collect this information in any capacity. What it does do is customize your report for your age, your gender, and your zip code, and it personalizes the first page of your report. So you can enter your name and last name, or you can put in your initials, or you can put in a nickname, whichever you prefer. I'm going to enter sample Patron. Now, the report can be upwards of 60 to 80 pages in length because we provide pricing for every insurance company that provides services for your specific area. So if you do want a copy of the report emailed to you so you don't have to print it in the library, you can enter your email address here and a copy of the report will be sent to you. Okay, and then most importantly, you want to enter your age, your gender, and your zip code. We'll do 60016 because that is how the pricing is customized, and then click Get Report. Now this is going to swirl for a moment, and this is a copy of the report that I downloaded earlier this morning. So let's increase this view a little bit. And we want bookmarks. The bookmarks are pretty handy within the PDF, so you can jump from one section to another. Okay, so let's walk through the individual parts of the report. So the report starts with 4 decisions that you might want to consider when you are, kind of charting out your plans for potential Medicare supplement insurance. Decision number 1 is, should I seek to get better health insurance coverage than Medicare alone can give me? Question number 2 is, how should I cover that gap between my medical bills and what Medicare pays? Decision number 3 is, which Medigap plan should I choose? And decision number 4 is, which insurance company should I buy my Medigap plan from? And this report will help you make those decisions. So the next section is answers to your questions about Medigap. And this table provides you a long list of different medical procedures. And so you can find out what Medicare pays and what you would pay out of pocket. Now, this is a handy tool if you are maybe, just turning 65 and, you want to find out, well, based on what my routine medical care needs are, what is my out-of-pocket cost going to be as an estimate? So using this chart, you can, make those calculations based on, how many times you visit your doctor a year, what medical procedures you normally do, that type of thing. And this chart goes on, for a whole bunch of different medical procedures. The next section is, what are the gaps in coverage? And we talk about deductibles and copayments and what you're required to pay. Shortfalls, of course, and services not covered. The next section is, which Medigap plan should you choose? And that brings us to that summary chart that we were looking at earlier with the 10 Medigap plans and what services they provide. So as you can see, Plan A is the least amount of coverage. Plans F and Plans G are the most comprehensive coverage. And again, the difference is this Part B deductible, where in Plan G, you pay it yourself, and in Plan F, you have the insurance company pay that $203 on your behalf. So then we go on to answer your questions about, well, which insurance company should you choose? And then the next section is broken up into individual plans. So you can learn more about what that plan covers. And remember, every insurance company that offers that plan is providing the same exact benefits because the plans are regulated. They have to be exactly the same. And then in the next section, we have a long list of every single insurance company that will provide that plan for this particular person's age, gender, and zip code. And we give you a list of what they actually cost per year. Now, these lists are organized by Weiss financial safety rating. So this first section is companies that are a B- or higher in terms of their financial strength. And you can see that Blue Cross Blue Shield of Illinois has a B+ rating, and they're the least expensive insurer in that B- or higher category at $900 per year annual premium for this Plan A. And then let's look at some others. This National Guardian Life, that's $1,641 per year compared to $900 for the same exact plan. And then you have Aetna Life at $1,906 and others up to, 2,900 and 33 over 3,300. Then next section, these are companies with a safety rating of C minus to C plus. Now, a C rating is average. It's fair. That's not a bad rating for us. So I wouldn't advise someone to not go with a company that has a C rating. That's average. Now you'll see these double asterisks throughout the report, and that means that's a policy sold through AARP. Now AARP only underwrites their Medicare supplement insurance through United Healthcare. So if you do get a mailer about a Medigap plan that's offered through AARP, United Healthcare will be your provider. And in this case, that's a pretty decent price for this plan A. You could save a little bit if you went with that Blue Cross Blue Shield plan, knowing that it's the same exact benefits. But this allows you to compare every single insurance company so that you know that you're getting a good rate. So let's go ahead and jump to Plan G. So again, each plan has a narrative so you can learn more about the benefits offered in that plan. And then you have a list of every single insurance company that will offer that plan to you and what they actually charge. So in the B minus or higher financial safety rating, this Blue Cross Blue Shield of Illinois is $1,284 per year. And you can scroll through and see how the prices vary for Plan G. And there's quite a lot of difference between the pricing of these plans. Now, remember, every Plan G has the exact same benefits. So we're not talking Cadillacs and hatchbacks here. We're talking exactly the same benefits. And really what varies is the price. So you want to make sure that you're getting the best price available to you. And then here is our companies with C minus to C plus. Now this United Healthcare plan, again, this is an AARP plan. That's $1,175, so it's a good deal. Now, some of you might notice that there is, in most cases, a monthly premium listed. And in some of them, you might see NA. Now, this doesn't necessarily mean that this plan does not offer a monthly payment. It just means that this company didn't provide the monthly number to us because we collect this information directly from the insurance companies themselves. So if you have questions about a specific plan, I would recommend calling your insurance company just to get specific pricing just for you. And when you do want to make those phone calls, we also offer an index of the Medigap insurers in your plan. So you'll have information about where they're located and their phone number to make it easy to contact the individual providers if you have questions. And I do recommend that if you have questions about the individual Medigap plans, their coverage, to, talk to your doctor and make sure that the plan that you're selecting is going to provide you the coverage that you want. You can call the insurance company and ask them questions to get your questions answered. And then definitely take advantage of those SHIP counselors who are super helpful and, can, give you some peace of mind that you're making the right decision for your unique healthcare needs. So let's go ahead and just take a look at the Des Plaines Public Library website one more time. And so you can see where to find the Weiss Financial Ratings site. So you're going to click on the Resources tab and then Business and Investing. Now we're in the business and investing section because there's other content on the platform that you might want to take advantage of. We provide investment ratings of stocks and mutual funds and financial ratings of banks and credit unions in addition to insurance companies. So you're welcome to poke around on additional parts of the site. But for this presentation, we're talking about just the Medigap tool. So here you would enter your library card information. And then that would bring you to the Weiss Financial Ratings database. And, you can get to individual sections by clicking on information in the gray bar. But if you want to generate a Medigap report for yourself, click on the Medigap tab here. And then you would enter your information on this screen and then be able to go ahead and either email a report to yourself, or you can download it at the library, maybe save it to a flash drive and have access to it for as much as you need. So I'm going to go ahead and take a look in the chat to answer any questions that you might have. So if you do want to ask a question in the chat, you can hover your mouse over the Zoom bar and then, type anything in the chat screen. And Christina actually put an important note in the chat. I will be making a copy of the PowerPoint presentation slides that we reviewed today available to her in just a few minutes. So if you would like a copy of the PDF of those slides to refer to later, just email Christina at ctropia@dppl.org, and she'll be able to send you that information.